Can we change color of two central incisors by means of two monolithic zirconia crowns, but at the same time to integrate them into the color environment with adjacent teeth? Hello dear colleagues, we are back with BG dental cases, and this time we will be discussing very interesting clinical presentation where two central incisors were very dark, and we were going to change the color of these teeth by using of two monolithic zirconia crowns. I would like to say that this BG dental case is dedicated to our upcoming online masterclass about adhesive cementation and bonding to zirconia and glass ceramic, and I would like to say that we are ready to give one free place to this online masterclass for you guys, but you have to answer one question. So the question is, how can we change or how can we solve the problem when roots are exposed through soft tissues? How can we solve that problem? Okay, so let me just show you what I mean by that question, and then you will be able to see and to understand my question. So here is initial clinical situation, and we can see dark teeth, actually dark roots after root canal treatment. The coronal part can be solved by zirconia crowns or metal ceramic crown, or even maybe with Emax crown, I'm not sure, but anyways, but what to do with soft tissues? How can we solve the problem of exposure of roots through soft tissues? So write your answers in comments below this video, and we will define the winner at 20th of September in YouTube stories. Okay, so let's go. Here you can see our initial clinical situation. There were two old ceramic crowns that our patient was not very happy with, and he asked us if we can solve aesthetic problems by just replacement of these two crowns. This patient, as you can see, also has pretty big occlusal problem because his lateral incisors and canines are worn out, and actually we were discussing possibility to do a full mouth rehab case in that clinical situation, but unfortunately this patient was not able to afford that treatment planning. So he just asked us to solve the central incisor problem, and then in the future he will be able to go for full mouth rehabilitation. And that case was pretty interesting for myself because I don't have too much single crown cases in order to test my dental technician if he can match the color of artificial restoration into the environment of adjacent teeth. So basically I was really looking forward to get this case and to see our ability to solve that kind of clinical cases. So if you want to integrate any of crown or veneer or anyway anything to the adjacent teeth color, you have to give your dental technician as much information as you can. And one of the most efficient way to share information with dental technician is to utilize gray card and polarized filter. So that is the picture with a polarized filter, and having this picture, your dental technician can upload it into the software, for example like in Lightroom, and he can determine white balance using this gray card, and then when he will be performing restorations with ceramic, he can take also picture of his restoration with the same gray card with polarized filter, and he can do actually digital try-in to compare color of adjacent teeth and color of his restorations. You will see this sequence later on, but I would like to say, if you want to know more about that approach, I would refer you to Elab protocol by author Sasha Hein. He is a dental technician from Germany. He is the author of this concept. They have a YouTube channel, they have also Facebook group for dental technicians, and actually, to be honest, This protocol is way more important to be understood by dental technician, not by yourself as clinician. As the clinician, you have to give your dental technician as much information as possible with your dental photography, and that's it. And then your dental technician will be able to understand what type of ceramic, what type of color, what type of stain, what type of mass to use in order to integrate this crown or veneer into the color environment of adjacent teeth. So we also made another picture with a polarized filter and gray card from lower teeth, just to give our dental technician that information, because as you remember, upper teeth of this patient, lateral incisor, for example, they were worn out with attrition, so it was not so easy to understand which color to follow. But for the lower incisor, was way easier. So once we removed crowns from central incisors, we found that type of tooth abutments. They are discolorated after root canal treatment, and was not so easy to mask these abutments in such a case. I isolated these teeth for root canal treatment, and to be honest, I don't know what is this. It's not just a silver cones. I think these silver points were the part of fiberglass posts. So anyways, we removed this old dentistry, and then we built up new coronal parts of tooth abutments, and I would like now to share with you some clinical tips to make your dental technician life easier. So basically what I made, I used opaque composite over that discolorated coronal part of teeth, so you can see that my composite was faced or spreaded more over that roots, so that will be easier for dental technician to perform restoration, but still I'm not able to solve root exposure through soft tissues. So the question was how to solve that problem. Okay, you remember that you have to answer that question in comments, and 20th of September we will define winner through all colleagues who answered correctly, and we will give you free access to our online masterclass about adhesive cementation of crowns and ceramic onlays. Okay, so then we decided to go for monolithic restoration because, you know, if you work with classic approach, when you have porcelain fused zirconia, when you have like zirconia abutment, which can be very opaque and you can really change any color you want. You can mask metal posts, for example, but then you have to layer ceramic over. But in that case, considering occlusion of this patient and risk to get chipping of that restorations, we decided to go for monolithic zirconia. And you know that this monolithic zirconia, it is translucent, okay, and that is not easy. Actually, it is impossible to mask that dark color of teeth by just using translucent zirconia. This multi-layered translucent zirconia is very aesthetic because you can have like a very smooth transition from dentine to enamel, let's say, but it is not able to change the color. But in comparison with Emax, for example, or lithium disilicate, that type of zirconia with some tips that dental technician can use, you can change the color. And I will show you these tips because it is really simple and very efficient way to block color of tooth abutments. So you can see here on that slide that the first picture is zirconia just after milling. This is zirconia after first staining and sinterizing, and this is the last one with external staining and glazing phase. So let's go. You can see here the view for palatal side, which is pretty nice looking, and I would like to highlight that there is no ceramic over zirconia, so we have only monolithic restoration with stains here. And actually here is the tip itself. dental technicians can use internal stains at the stage of sinterizing. So basically, there is a special opaque stain the dental technician applies before sintering, and this stain will be integrated into the structure of zirconia. So basically, this stain is pretty stable, let's say, and being super opaque, it really can change the color of even dark or black teeth. So that is a tip. You can share this tip with your dental technician. And then also one thing that I tried this case is to use a bonding protocol for zirconia, because we know that there is a strong belief that there is no bonding to zirconia. But if you will Google, or you will find out articles by Markus Blatz and authors, because they dedicated to research of zirconia bonding almost 20 years, and they found out the concept that is called APC, and they showed that zirconia can be bonded and you can get chemical adhesion from phosphate groups out of your MDP primer to Z groups from zirconia. Okay, and you can also find out another research that is not related to Markus Blatz. So basically you can say that there are independent sources of literature that can show you some numbers and long-term numbers out of the zirconia bonding. So why do I choose zirconia bonding instead of classic cementation in such a case? I would go back to few slides. I would go back few slides and show you again tooth abutments. Unfortunately, these teeth, the length of these teeth is not so long to be able to give me predictable mechanical retention. So we don't have enough mechanical retention. That's why the question was, why don't we get some bonding using the APC protocol to bond our zirconia in such a case? Using that tip with internal stain to be able to mask the dark color of the tooth and bonding, we can get acceptable and optimal, let's say, result in that clinical situation. Okay? So that was the idea. And here you can see the steps of dental technician work. So he made these zirconia crowns, he stained these zirconia crowns, he took pictures with a polarized filter and gray card, and now he can evaluate, he can compare his crowns with adjacent teeth. Actually, this is the picture of digital try-in. So from the right side you can see cropped picture from the model. Let me go back here. Yeah, here is it. So basically this is the cropped picture from the model that was brought to the intraoral picture, and then you can see the adjacent lateral incisors to be able to understand if the color matching would be okay in clinical try-in. So this is the picture of zirconia crowns straight after bonding. So pretty good result, and I would like to highlight that there are monolithic restorations with no ceramic enamel or whatever. So basically it's very nice aesthetic result that can show you the ability of present dentistry following some really nice color matching protocols as Elab. Adjacent teeth like lateral incisors and canines were restored with direct composite restoration in another clinic. Unfortunately, I don't have picture, but I'm pretty happy with my two centrals because we got nice color integration, we got also bonding, we got pretty nice aesthetics, and the result was really nice because I knew now that my dental technician can do that type of difficult cases by any material that he has in his lab, which is really nice. But it is also possible for the rest of dental technicians if they will use proper tools and proper protocols. The same as for clinicians. If you will follow proper protocols, proper tools, you'll get result. You have to give yourself a little bit more time maybe to practice, to get some experience, and then you'll be very nice in certain clinical disciplines. So again, one more time, let me invite you to our online masterclass that will be in November. The masterclass about bonding zirconia crowns and ceramic overlays, where I will show you step-by-step procedures of bonding, and I will give you highlights, tips and tricks regarding cement, the choice of cement, the proper protocol for cementation, and also there will be a part of rubbing isolation specifically for bonding procedures. So that's it, my friends. It was really nice to share that information with you, and I hope that you will get some tips and tricks out of this BG Dental case. Don't forget to write your answers in comments to get this free access. And according to our tradition, I would like to say at the end that may the dental force be with you guys. Bye bye. See you later.